Hello, everyone. Hi, and do. Prostate healthcare misunderstandings. Don't let these behaviors quietly destroy it. The truly effective maintenance method is here. In the map of men's health, the prostate is a special and sensitive existence. It is hidden deep in the pelvic cavity like a chestnut, but it affects the health nerves of countless men. You may not know that this small organ located between the bladder and the urethra and backed by the rectum due to its special position may even be stimulated by feces in the rectum during defecation, which makes some men feel indescribable pleasure. It is precisely because of this physiological particularity that prostate massage has become the focus of excessive exaggeration by merchants. From improving sexual ability to preventing prostate cancer, from prostate maintenance to experiencing prostate orgasm, these extremely tempting labels have attracted many men. But how many exaggerated truths are hidden under this mysterious veil? What are the health traps behind those blushing propaganda? Unveiling the mystery of prostate massage, why has medical means become a commercial gimmick? To find out the truth about prostate massage, we must first return to the essence of medicine. In the men's and urology clinics of regular hospitals, prostate massage is a serious medical operation. After wearing gloves and applying lubricant, the doctor inserts his fingers 4 to 6 cm from the anus and gently presses the prostate from both sides to the middle with the fingertips to collect prostate fluid for examination or assist in the treatment of chronic prostatitis. This process usually lasts 3 to 5 minutes. After the end, the patient needs to urinate in time to reduce urethral irritation. The guidelines for the diagnosis and treatment of urological and men's diseases in China clearly states that prostate massage combined with medication can shorten the course of type II prostatitis and relieve discomfort such as perineal swelling, frequent urination under. At the same time, doctors can judge the size, hardness, and presence of nodules of the prostate by touch, providing a basis for diagnosis of diseases such as prostate hyperplasia and tumors. In other words, in the medical scene, it is a tool for diagnosis and treatment, not a means of health care. But when this medical technology flows into the commercial market, its nature has completely changed. The prostate maintenance project of the Street Health Club packages medical operations as sexual pleasure experience and uses words such as climax and enhanced sexual ability to create gimmick. What is even more dangerous is that non-professionals lack anatomical knowledge and may use violent pressing instead of gentle massage or repeatedly stimulate the gland. This is by no means alarmist. In clinical practice, there have been cases where patients have prostate congestion and edema, urethral damage, and even acute prostatitis due to street massage. There is also a more hidden risk: cross-infection. If street agencies are not thoroughly disinfected, bacteria carried by gloves and instruments may enter the body through the anus, causing proctitis, urethritis, and even aggravating existing prostate diseases. For men with hemorrhoids and anal fissures, rough massage may also cause anal tearing and bleeding, making the situation worse. Why is the prostate so delicate? Revealing the importance of the male life gland. The reason why the prostate is called the male life gland is inseparable from its function. It surrounds the beginning of the urethra, like a valve controlling urination and ejaculation. During urination, the prostate's smooth muscle relaxes and the urethra is unobstructed. During ejaculation, the prostate contracts and pushes semen into the urethra. In addition, the prostatic fluid secreted by the prostate is an important component of semen, providing nutrition and activity environment for sperm. It can be said that it is directly related to men's fertility and quality of life. But this key organ is particularly fragile. Data show that more than 50 of men in the world will encounter prostate problems in their lifetime. The prevalence of prostatitis in men over 35 years old in my country is 15 to 20, and the incidence of prostate hyperplasia years over 50 years old is over 50, and it is as high as 90 for those over 80 years old. Behind these figures are countless men who are troubled by symptoms such as frequent urination urgency, urinary pain, and perineal pain. In history, many celebrities have also been tortured by prostate diseases. In addition to Chiang Kai-shek, who suffered for many years due to the sequelae of prostatitis surgery, former U.S. President Reagan and British Churchill were both troubled by prostate hyperplasia. Churchill was hospitalized many times due to prostate problems in his later years, which even affected the handling of government affairs. Reagan underwent prostate surgery at the age of 70, and after the surgery he admitted that the number of nocturnal urination has been reduced from 5 times a night to 1 time, and I can finally sleep a full night. These examples are enough to show that prostate health is directly related to the quality of life and cannot be ignored. What is more worthy of attention is the trend of younger prostate diseases. In recent years, the proportion of male prostatitis patients aged 20 to 30 has increased year by year, which is closely related to the habits of contemporary young people, such as long-term sitting, staying up late, and eating spicy food. According to the data of the male outpatient department of a tertiary hospital, 90 of patients aged 25 to 35 have the habit of long-term sitting more than 8 hours a day and frequent staying up late, among which programmers, drivers, and students account for the highest proportion. 7 invisible killers that hurt the prostate more than holding urine. You may do it every day. When it comes to behaviors that hurt the prostate, many people's first reaction is holding urine. Indeed, holding urine for a long time can cause the bladder to be overfilled, compress the prostate, and may also cause urine reflux to cause infection. But in life, there are 7 more hidden habits that are quietly destroying prostate health, but they are ignored by most people. 1. Sitting for a long time. Let the prostate soak in congestion. When sitting for a long time, the pelvic cavity is in a state of congestion. The prostate is squeezed between the rectum and the pubic bone. Blood circulation is blocked, and metabolic waste cannot be discharged in time, just like soaking in congestion. A study by the Chinese Journal of Urology showed that people who sit for more than 8 hours a day have a 2-3 times higher risk of prostatitis than ordinary people. What's more frightening is that the combination punch of sitting for a long time and holding urine doubles the harm. Many office workers and drivers are used to holding urine and not going to the toilet, but they don't know that the prostate is under the double pressure of the bladder and the seat at this time, and the damage comes faster. Solution: get up and move for 5 minutes every 40 minutes of sitting. Do standing against the wall, back against the wall, tighten the buttocks and pelvic floor, walking on tiptoes, walking 100 steps on tiptoe to promote pelvic blood circulation. To alcohol, make the prostate swollen. Repeatedly, alcohol is the #1 enemy of the prostate. After drinking, alcohol will dilate and congest the blood vessels of the prostate, just like blowing a balloon to make the gland swell. If you drink too much at once, prostate edema may last for 3-5 days. Long-term drinking will lead to chronic congestion, induce prostatitis, or aggravate hyperplasia. Clinically, it has been found that the difficulty of treating prostatitis in alcoholics is 40 higher than that of non-drinkers, and the recurrence rate is doubled. Solution: adult males should not consume more than 25 grams of alcohol per day, about 750 ml of beer, 250 ml of red wine, and 50 ml of white wine, and have at least 2 no alcohol days per week. If you already have prostate disease, it is recommended to quit drinking completely. 3. Spicy food. Invisible flame that burns the urethra. The capsaicin in peppers will not be digested and absorbed by the human body, but will be excreted with urine, stimulating the prostate and urethral milk cell along the way, causing burning sensation and congestion. Studies have found that eating spicy food for 3 consecutive days will increase the number of white blood cells in prostate fluid by 30, which is a typical manifestation of inflammation. Data from male clinics in spicy areas such as Sichuan and Hunan show that 80 of prostatitis patients have the habit of not being able to live without spicy food. Solution: eat spicy food no more than 2 times a week. Drink more water, more than 2,000 ml per day, after eating spicy food, or drink a glass of yogurt to protect the mucosa. For those who already have prostate problems, it is recommended to eat a light diet and avoid spicy foods such as peppers, and ginger. For wrong riding, heavy pressure test of the prostate. When riding a bicycle, the seat will exert pressure on the perineum, and the prostate happens to be in this pressure zone. The hard seat cushion of an ordinary bicycle will cause the prostate to bear more than 70 of the body weight. Long-term riding will cause congestion and edema of the gland. A sports medicine study showed that after riding for 1 hour continuously, the blood flow of the prostate will decrease by 50, which is equivalent to the hypoxia state. If the seat is too high or too low, and the body leans forward too much, the pressure will be more serious. Solution: choose a breathable cushion with a groove in the middle, and the seat height should be slightly bent when the foot is at the lowest point. Get off the bike every 30 minutes when riding, and gently massage the perineum for 1 minute with your hands or professional cycling to reduce friction and pressure. 5. Staying up late reduce the immunity of the prostate. Staying up late will disrupt the body's biological clock and lead to a decrease in immunity. And the prostate is one of the first organs to lose when the immunity is. Studies have found that the incidence of prostatitis in men who stay up late for a long time fall asleep after 2 and is 8 times that of those who have a regular working dressed schedule, and the recurrence rate after treatment is higher. This is because staying up late will increase the inflammatory factors in the body, and the prostate will continue to be in a susceptible to infection state. Solution: try to go to bed before 2300 and stay away from electronic screens 1 hour before going to bed. If you have to stay up late, make up for 2 hours of sleep the next day, and eat more fruits rich in vitamin C such as oranges and kiwis to help repair immunity. 6. Irregular sex life. Burden and congestion of the prostate. Excessive sex will cause repeated congestion of the prostate, like an overrunning machine, and long-term abstinence will prevent the prostate fluid from being discharged in time, and it will accumulate in the gland, inducing inflammation. Clinically, it has been found that men with fluctuating sex frequency have a 60% higher risk of prostatitis than those with regular sex. 4. Middle-aged and elderly men. Excessive sex may also aggravate the symptoms of prostate hyperplasia. A 65-year-old patient had severe urination difficulties due to having sex 3 times a week. The doctor found that his prostate was congested and swollen, compressing the urethra. Solution: the frequency of sexual life should be based on the principle of no fatigue afterwards. 2 times a week for 30-40 years old and once every 2 weeks for those over 50 years old. If there is no sexual life for a long time, moderate exercise such as running and swimming can promote the discharge of prostate fluid. 7. Abuse of supplements, adding fuel to the fire for the prostate. Many men are superstitious about kidney tonifying and yang strengthening supplements, but they don't know that most of these products contain androgens or hormone-like ingredients which will stimulate prostate hyperplasia. A 45-year-old man took a certain yang strengthening drug for 3 months, and the volume of his prostate increased from the normal 20 ml to 45 ml, and he had acute urinary retention. In addition, long-term use of caffeinated energy drinks will also stimulate the prostate and aggravate the symptoms of frequent urination. Solution: health products should be taken under the guidance of a doctor. Do not believe in false propaganda such as aphrodisiac enlargement. If you want to regulate your body, you can choose food ingredients such as wolfberry and yam, which are safe and have no side effects. Scientific maintenance of the prostate. A full plan from diet to exercise. Protecting the prostate does not require high technology. The key lies in daily details. In addition to avoiding the above-mentioned minefields, these simple and easy methods can help you protect the life gland. 1. 3 gland protection actions. 10 minutes a day is enough. Schedule exercise, that is, eye lifting exercise, which can enhance the strength of the pelvic floor muscles and improve the blood circulation of the prostate. Practice: contract the anus just like holding back a bowel movement. Hold for 5 seconds, relax for 3 seconds, 3 sets a day, 20 times each set. Persist for 1 month, and frequent urination and urgency can be significantly improved. Cat stretch: kneel down. Support the ground with both hands, raise your head and collapse your waist when inhaling, and arch your back when exhaling, and repeat 10 times. This action can relax the pelvic muscles and relieve the pressure on the prostate, which is suitable for people who sit for a long time. Squat against the wall, with your back against the wall. Spread your feet shoulder width apart. Slowly squat to 90 knees. Hold for 30 seconds, 3 sets a day. Squats can promote blood circulation and the perineum and enhance prostate metabolism, and are called prostate health exercises by urologists. Types of gland protecting foods. Eat more daily for better health. Mushrooms, especially button mushrooms and shiitake mushrooms, which are rich in selenium and polysaccharides, can enhance immunity and inhibit prostate cancer cells. A study by Johns Hopkins University in the United States found that men who eat mushrooms 3 times a week have a 60 lower risk of prostate cancer among them, but mushrooms have the most significant effect, which can reduce the level of prostate-specific antigen PSA by 50p. PSA is an important marker for prostate cancer, and the higher the level, the greater the pumpkin seeds contains rich zinc and phytosterol. Zinc can maintain the normal function of the prostate, is one of the organs with the highest zinc content in the human body, and phytosterols can inhibit prostate hyperplasia. Studies have shown that eating 20 grams of pumpkin seeds a day can reduce the risk of prostate hyperplasia by 30 and improve the number of nocturia. In addition, the fatty acids in pumpkin seeds can nourish hair-killing 2 birds with 1 stone. Gland protection habits. Details determine health. Drink 1,500 to 2,000 ml of water every day, equivalent to 8 cups, which can dilute urine and reduce stimulation to the prostate. It is recommended to drink 300 ml of warm water on an empty stomach in the morning, drink evenly during the day, and drink less water 1 hour before going to bed to avoid nocturia. Warm water bath. Use warm water of about 40 for 15 minutes every night to relax the prostate muscles and improve blood circulation. Note, men who have not given birth should not take long-term baths, may affect sperm motility, and can be replaced by hot compresses on the perineum. Urinate in time. Don't hold it when you want to urinate, especially when the bladder is full in the morning. Urinate in time to reduce the pressure on the prostate. After urinating, you can gently press the perineum to help discharge residual urine. Regular physical examination. Men over 50 years old should undergo prostate-specific antigen PSA testing on rectal examination once a year, and those with a family history should do it in advance at the age of 40. These tests and detect prostate cancer at an early stage with a cure rate of more than 95%. Prostate health is related to men's quality of life and dignity. Instead of being misled by a false propaganda from merchants, it is better to develop good living habits from today. Sit less and move more, eat a light diet, have a regular work and dress schedule, and have regular physical examinations. Remember, no shortcut is more reliable than scientific maintenance. Your prostate deserves to be taken seriously.